Pharmacology is a branch of medicine concerned with the uses, effects, and the modes of action of drugs. It studies how different chemicals affect biological systems and incorporate knowledge and skills from a number of basic science disciplines including physiology, biochemistry, and cell biology. It is specialized in dealing with drugs, their mechanism, their effect on the body, and how body deal with these drugs as well. This is the beginning of a series of videos to dig deep into this beautiful science. This is Pharmacology Horizons, and today we are going to give an introduction. Hello guys, and welcome to Pharmacology Horizons. Pharmacology as a word consists of two parts, pharmaco, which means drug, and ology, which means science or study. So obviously, pharmacology is a science dealing with all aspects of drug. The relationship between human body and drugs is like a fight, where both of them tries to impose its own control over the other. Human body tries to manipulate drug in four processes, which are absorption, distribution, metabolism, and excretion, collectively known as pharmacokinetics. On the other hand, the drug also tries to impose its own control and exert an effect on the physiology of the body organs. This is called pharmacodynamics, through which we are going to know all about drug mechanism of action and its side effects. So, the two big branches of pharmacology, as we see in here, is pharmacokinetics, which is a study of the effect of the body on the drug through these four processes, or the other part, or the other big branch, is the pharmacodynamics, which we will study the mechanism of action and side effects. So, pharmacokinetics is the study of drug movement throughout the body, and this helps us to know all about drug onset and drug duration. Onset of the drug is the time from administration of the drug till appearance of its action, and it's affected by rate of absorption. Absorption here, guys, means the movement of the drug from the site of administration towards the blood, or to reaching the blood circulation. The other term we will know about from pharmacokinetics is duration, which is time from appearance of the effect till disappearance of the effect, which is affected by the rate of metabolism and the excretion. And we will know the definition of these words later. However, to know more about drug kinetics, it's better understood from the following curve. As you see in here, there is a relation between the amount of the drug in the blood and time, starting from when the drug is taken. When the drug is taken, its concentration in the blood starts to increase, as you see in the black line. However, you will see another horizontal blue line ends with a word called MEC. MEC is the minimum effective concentration, which is the lowest concentration of the drug to be found in the blood to exert a pharmacological action. So the time here, or this black line here, the drug does not give a pharmacological action until reaching the blue line. The point of intersection between the blue line and the black line is called the onset. So the drug starts to give its effect at this time interval. The drug continues to increase by the effect of absorption, so the drug is going by higher amounts from the site of administration towards the blood till reaching the Cmax, when all of the amount of the drug is absorbed. After which, drug amount in the blood starts to decline by the effect of metabolism and excretion. Drug is being eliminated from the biological system till reaching again the blue line of the MEC. At this point, drug action disappears, and we call this point offset. So the time interval between the onset and the offset is the duration of action of the drug. So the drug will act for 3 hours, 4 hours, according to the type of the drug. So, okay. Another term you will see here is AUC. AUC is the area under the curve. Area under the curve refers to the total amount of the drug exposed to the body. You will also see another blue line above here with the word MTC. MTC is the minimum toxic concentration, which is the concentration at which the toxic effect of the drug starts to appear. So obviously your dose or your drug dosing should give your amount of drug in the blood between the two lines. The distance between the two lines is called the therapeutic window. As the therapeutic window is higher, or the distance between the MEC and the MTC is higher, you have a larger dosing intervals to give for this drug. So this drug is called to be safe. However, for other drugs, the distance between MTC and MEC, or the difference between MTC and MEC, is so low. So you might find that MTC is just right here. So you have low dosing difference or low therapeutic window. It's easy for these drugs to be toxic. Such drugs are called narrow therapeutic index drugs, and we are going to talk about this later, such as warfarin and Digox. Let's take a look at the journey of the drug after administration. When you take your tablet orally, it passes through the GIT. Drug is absorbed towards the liver through the portal vein where it exhibits metabolism. In this case, it's called first pass metabolism because part of the drug is metabolized before reaching the circulation, after which the drug leaves the liver through the hepatic vein, which connects with the inferior vena cava towards the heart, where it's pumped in the blood to all body organs, including the liver itself again, including the kidney and all other organs. Take note that drug enter the organs to exert its action and leave them again towards the blood in the process of distribution. So distribution is a reversible process where the drug is distributed to all body organs and then come out again from these organs and so on. Part of the drug reaches the kidney may be excreted in it if it's polar. However, if your drug is still lipophilic, it will be reabsorbed again in the circulation and so on. When you take your drug through a parenteral route, through intramuscular injection, through intravenous, or so on, the drug reaches the blood more rapid than taking the drug through the oral route. So drug in parenteral way have more rapid onset than the oral route. Let's talk about the full process of pharmacokinetics, starting with absorption. As we said before, absorption is the process of moving the drug from the site of administration towards the blood by passing a biological membrane. This process should be irreversible. You want your drug to pass only in the direction towards the blood circulation. So also the factors affecting this absorption process include pH of the absorbing environment. So when the drug is acidic or the weak acid drug and it's found in a basic media or alkaline media, it will have a positive charge as you study in chemistry. Drugs with positive charges or drugs with true charges on its surface will not pass a biological membrane. The drug should have no charge. The drug should be lipophilic. Not 100% lipophilic, but should have 60-70% of lipophilicity. Okay, other factor is the blood flow to the absorption site and the total surface area. As the blood flow and the total surface area of the absorptive site increase, the rate of absorption of the drug from this site will increase. Also, contact time at the absorption surface. As the time increases, also the amount of the drug absorbed will increase. Mechanisms of absorption are variable and includes all types of transport you have studied in physiology, like active transport, passive transport, and phagocytosis also. The following process is the distribution process. Distribution is the process by which a drug reversibly leaves the bloodstream and enters the interstitial fluid or cells of the tissue. Drug in the blood may be found in either one of the two states or both of them, either free state or bound to a plasma protein. Free drugs are free to be distributed within the tissue to interact with receptors on the cell surface or enter the cell to interact with proteins, intracellular proteins, or even make a change in the interstitial fluid. Then it will move back again to the blood. However, the bound drug is not able to enter the tissue and remain in the blood inactive. It will replace any excreted amount of the free drug. So bound drug is like a store. When some of these free drug is excreted through the kidney, it will be replaced from another amount from the bound form. Significant to know the percent of drug bound to a plasma proteins comes when you take another drug. For example, when you have a patient who takes warfarin will have 90% of its dose bound to plasma protein, and the other 10% is active because they are free. When this patient takes sulfonamide, let's take that the green parts are sulfonamide. Sulfonamide will replace warfarin from its plasma protein sites, thus the amount of the free warfarin will increase. So it will be more than 10%, it will be 20%, 30%, according to the dose or according to the amount of the replaced warfarin. So the amount of the free warfarin will increase, and this will increase the toxicity of the warfarin. As we said before, warfarin is one of the narrow therapeutic index drugs. It's easy to reach its toxicity. Distribution process depends upon four things. Blood flow to the organ, so organs with higher blood flow will have more drug distributed to them. Capillary permeability, some organs have specific membranes around them, so not all the drugs can enter the brain, for example, because the brain have blood-brain barrier surrounding it, or the testis, or the placenta. Degree of binding of the drug to the plasma and tissue protein, as we said before, only free drugs are distributed to the tissues, while the bound drug is not distributed. And relative hydrophobicity of the drug. The more lipophilic the drug, the more it will be distributed to tissues. We have here what's called the volume of distribution. Volume of distribution is a hypothetical volume of fluid into which a drug is dispersed. Hypothetical means it's not real. However, it will give a hint about the amount of where the drug is distributed. You have around 42 liters of fluids in your body. 5 liters of blood or 6 liters of blood. You have some fluid in the interstitial fluid. The remaining part is the cellular fluid, and so on. So when you calculate VD is stated in liters, drug dose divided by the concentration in the plasma. So let's say that you give a high dose, and then when you choose to measure the concentration of the drug in the plasma, you found it low. It means that the drug left the blood towards the tissues. So in high VD, or drugs with higher volume of distribution, it means that it's distributed among the whole body, or it's found in tissues more than it's found in the blood. On the other hand, when the drug has lower volume distribution, it means that it's found in the blood more than it's distributed to the tissue. What is the significance of knowing the VD of drugs? Its significance, it's useful in knowing in some situations or in some cases when there are a toxicity from one of the drugs. Let's say that a patient came to the emergency room and he has taken 35 tablets of some drug. When this drug have high volume of distribution, you know that the drug is distributed in the tissue, so using hemodialysis will not be effective. However, when this drug have low volume of distribution, and you know that it's found in the blood, so hemodialysis process is effective. So a higher VD drug means it has a high concentration of the drug in the tissue, so hemodialysis is useless. While low VD or lower volume distribution drug in the blood and is not in the tissue, so hemodialysis here is effective. So what do you think, guys? What do you think make a drug has a higher VD and the others not? Yeah, the answer is in these 4 factors, especially this one. When the drug is highly lipophilic, it's distributed among the highest amount or the highest percentage of tissues, like CNS drugs, benzodiazepines, and so on. These drugs are too lipophilic. They are distributed. When you calculate their VD, you'll find it 72 liters, 80 liters. And that's why you are calling volume distribution hypothetical. You don't have an 80 liters of fluids for the drug to be distributed in, so it's hypothetical. We will continue to give introduction about pharmacology. Tell me in the comments what you think about this content and what type of drugs you need to know about. Don't forget to subscribe, like, and share videos. Stay positive, share your knowledge, and make the best benefit of your existence. See you guys next video. Bye.